Hello and welcome to the Pharmacy Informatics Professor 2020 with your host, Dr. Armin Simonian. I'd like to talk today about IV workflow management systems. So these are the systems that we use that get us away from manual production of compounded sterile products, and we can use either semi-automated or fully automated systems to help us with compounding our IVs, to make sure that we're observing all of the 5 rights, and getting the right amount of drug into that IV is very important, besides verifying that it's the right ingredient. And I would like to bring up a presentation and go a little bit more into depth on this topic. So let's talk about IV workflow management systems. So in the old days with totally manual IV workflow, and this still happens today because not everyone is on IV workflow systems. So what we have to do is visual verification of IV solutions and additives. So whatever the bag is, normal saline, D5W, whatever it happens to be, you have to verify that you have the right product. And then you also have to verify the additives. And this is done visually because we don't have the benefit here of any kind of scanning or visual images to help us with this. ISMP has recommended against use of the syringe pullback method. So this is where you have a technician making your IV under the hood. They add the additive to the IV bag, and then they pull back the syringe, fill it with air, back to the volume that they injected into the bag. So this is supposed to indicate how much of that additive they put into the bag. But it's not reliable, and if there's a distraction or the technician isn't paying attention or doesn't pull it back exactly to the right spot, then we don't have a high degree of confidence that we've put the right amount of drug into the IV solution. The other thing that happens, especially when you have multiple ingredients in the IV, is the technician will add 2 or 3 ingredients and then place the syringe next to the vial. And depending on how they line those up, it might be confusing about which syringe goes with which vial. And this can also cause a medication error. So ISMP has definitely spoken up against this syringe pullback method. But it's used a lot, even today, by a lot of institutions that have not been able to implement IV workflow management systems and still rely heavily on pharmacy technicians to prepare solutions that are then verified by the pharmacist. With USP 797 and the fact that we have to have clean rooms in our hospitals and gown and glove before we go into the clean room, this is a problem for the pharmacist who's covering the entire pharmacy, but must glove and gown to go in and check IV solutions that are being prepared by technicians within the clean room. This can be very time consuming and costly, and it's something that has to be done then if you don't have the automation of the IV workflow management system. And another thing, and I'm guilty of this too, we have a tendency towards batch production when we do IV batches in the hospital. You might print out all of the labels that are needed for doses for the next 12 hours or 24 hours in your hospital. And if you have 10 gentamicin 80 milligram IV piggyback bags that you need to make, then you can go ahead and get 10 normal saline piggyback bags and a vial of 40 milligram per ml gentamicin, a 20 ml vial. Take your syringe, drop all 20 mLs into a 20 ml syringe, and then pick up each bag one by one and inject 2 mLs into each bag to give you 80 milligrams each in the 10 bags. And this can lead to a lot of errors with accuracy, having to stop exactly at each 2 ml increment. And then again, if there's any kind of distraction, you might end up causing a medication error with too much or too little in a given bag. Now with IV workflow management systems, we avoid a lot of these issues. And probably the best part of it is we don't have to rely on the syringe pullback method to verify the amount of drug that has gone into the solution. And so here I just have examples that you've seen before of a TPN compounder or semi-automated IV workflow where we take images and we use gravimetrics to make sure the right volume of additive is going into the IV solution. And then you have your fully automated robot that can prepare compounded sterile preparations without human intervention. So the benefits of these systems is that you can verify all the ingredients, the solution and the additives using barcode technology. You can also use gravimetrics to verify the additive volumes. So you plug in the specific gravity of each solution and system knows how much the weight should change as you add your additives. We also can capture images with a little camera under the hood, and we can document every step in the process, from showing a picture of the vial, including the lot number and expiration, showing the ingredient names, and then showing the solutions being drawn up. And with the solution still in the syringe, take a picture of how much is going into the bag. And then after the product is compounded, take a picture of the final bag and the label applied to show that it's been created, compounded properly. We can also have remote verification of the compounded sterile products without the pharmacist having to glove and gown and go into the clean room. So we can look at all of the images, all the statistics on what was scanned, and if the proper ingredients are in there, and if every step was done properly by the technician, we can then verify those solutions remotely. And the other thing that these IV workflow management systems do is they tend to have us make IVs just in time when the next dose is needed, and to do it one patient at a time and one dose at a time. So you typically will print a label of a bag that's needed and assemble the ingredients and then scan those, prepare your compounded sterile product, apply the label, have it verified. And when you do it one at a time, there's a lot less chance of an error in that preparation. The other thing that these systems do is they can have reminders. So as part of the workflow, especially when you're beginning a shift or at different time increments, we can have reminders for our technicians to check filters in our hoods, to check the airflow in the room, to do the cleaning steps that are necessary either for our hoods or for the floors and walls and ceilings. And we can follow all of the USP 797 regulations by getting these little reminders and documenting that those tasks have been done. So a lot of benefits to going with IV workflow management systems. And this is something that I hope will be implemented at every hospital, every compounding pharmacy in the country, because it really eliminates that syringe pullback method and really helps us have total compliance with USP 797 to make sure that we're having sterile, stable products that have exactly the right ingredients in them. If this discussion of IV workflow management systems was helpful for you, please like the video and subscribe to my channel, and I'll thank you for that. And in the meantime, stay safe, stay healthy, look after the health of others, and I hope to see you next time. Take care.